Gentlemen, let me ask you something very honestly. When was the last time you paused and asked yourself, is the way I touch my body still right for me today? Not the way you did it at 30, not the way you rushed through it at 40, but now, in your 60s or beyond. If you've noticed that things feel different, slower, less sensitive, or simply unfamiliar, this message is especially for you. Because what most men don't realize is that the same habits that once felt normal can quietly start working against your body as you age. And no one ever talks about this openly. Before we go any further, let me say this clearly. There is nothing strange, shameful, or wrong about this topic. In fact, understanding your body at this stage of life is one of the smartest and healthiest things you can do. If you care about your confidence, your circulation, your prostate health, and your overall well-being, you're in the right place. My name is Dr. Shruti. I am a urologist, and for the past 8 years, I've worked closely with men in their 50s, 60s, 70s, and even 80s, helping them maintain sexual health, comfort, and confidence as their bodies change. On this channel, PeakMale Health, we talk honestly about men's health without fear, shame, or awkwardness. And today, we're going to talk about something most doctors never explain properly: how to masturbate safely after 60, and the 3 big mistakes I see men making every single week in my clinic. Now, if this is the kind of guidance you want more of, do me a small favor right now. Take 1 second, hit the like button, subscribe to PeakMale Health, and stay connected with us. This channel exists to give you practical, science-based advice that actually respects where you are in life. And later in the video, I'll also ask you to share your thoughts in the comments, because your experience matters. Let's get one thing out of the way immediately. Masturbation is not only safe after 60, it is beneficial when done correctly. In fact, gentle self-stimulation plays an important role in maintaining blood flow to the penis, supporting prostate circulation, calming the nervous system, and helping many men sleep better. From a medical standpoint, regular mindful stimulation can help prevent stiffness in penile tissue, reduce congestion in the prostate, and keep the mind-body connection strong. But here's where many men get confused. Your body at 60 is not the same body you had at 25. That doesn't mean something is wrong. It means your biology has changed. Skin becomes thinner. Nerves respond more slowly. Blood vessels lose some elasticity. Hormones shift. Recovery takes longer. None of this is a failure. It's normal aging. The problem starts when your habits don't evolve with your body. I often tell my patients this. Aging is not about losing function. It's about changing approach. When you adjust how you touch your body, the experience can actually become more satisfying, more calming, and more supportive of your health than it ever was before. Over the years, I've noticed something interesting. Most men are not hurting themselves intentionally. They're simply repeating patterns they learned decades ago without realizing those patterns may now be creating tension, irritation, or frustration. And almost always, it comes down to 3 common mistakes. These mistakes don't sound dangerous, but over time, they quietly reduce pleasure, sensitivity, and confidence. Let's talk about the first one. The first big mistake is rushing. Many men treat masturbation like a quick task, something to finish as fast as possible. But when you rush, your body doesn't experience pleasure the way you think it does. From a biological perspective, rushing activates your stress response. Your heart rate increases, blood vessels tighten, your nervous system stays alert instead of relaxed. And when blood vessels constrict, blood flow to the penis actually decreases. Emotionally, rushing trains your brain to associate touch with urgency, secrecy, or pressure. Instead of being restorative, it becomes draining. Over time, this can reduce sensitivity and make arousal feel unreliable. The solution is surprisingly simple, but incredibly powerful. Slow down. Even a few extra minutes changes everything. Take a deep breath before you begin. Turn off distractions. Give yourself permission to be present. You don't need anything fancy. What your body responds to most is safety, and relaxation. When the nervous system feels calm, blood vessels open. Nerve endings wake up. Sensation improves naturally. Men who slow down often tell me they feel more control, more satisfaction, and far less frustration. This isn't about performance. It's about allowing your body to respond the way it's designed to at this stage of life. And this brings me to the second mistake, which is extremely common after 60, but rarely discussed openly: using too much pressure. As sensation naturally decreases with age, many men unconsciously grip harder or move more aggressively, thinking it will bring sensation back. But the penis is not designed for force. It's made of delicate tissue, fine nerves, and small blood vessels. Excess pressure can cause irritation, micro-injuries, and a condition doctors sometimes refer to as death grip, where the body only responds to one very specific type of intense stimulation. This doesn't just affect solo pleasure. It can also make intimacy with a partner more difficult and less satisfying. Emotionally, it often leads to frustration and confusion, especially when erections don't respond the way they used to. The healthier approach is gentleness. Loosen your grip. Let sensation build gradually. Using a simple, fragrance-free lubricant reduces friction and protects the skin, which becomes more fragile with age. Think of the experience less as stimulation and more as a form of circulation support. Gentle touch preserves nerve health, supports blood flow, and creates more consistent pleasure over time. Many men are surprised to learn that lighter touch often leads to stronger sensation once the body is allowed to relax. Now, there is a third mistake, and this one is often the most overlooked because it has nothing to do with the hands and everything to do with what's happening inside the mind. Ignoring your emotional state. By the time a man reaches his 60s, he often carries decades of stress, expectations, and sometimes quiet shame around sexuality. Messages from childhood, cultural pressure, performance anxiety, or fear of aging don't simply disappear. They settle into the body. Tight shoulders, shallow breathing, a tense pelvic floor. All of this directly affects arousal and pleasure. When the mind is tense, the body follows. And this is where compassion becomes essential. You are not broken. You are not past your prime. You are in a new phase of life that requires a different kind of care. When you approach self-pleasure with patience and self-respect, something shifts. Blood flow improves, sensation returns, and emotionally, men often feel calmer and more confident. At PeakMale Health, this is something we emphasize often. Men's health is not just mechanical. It's physical, emotional, and neurological working together. In the next part of this video, I'm going to show you how to build a safe, healthy self-pleasure routine after 60, what your body needs now, and how small adjustments can dramatically improve comfort, sensitivity, and confidence over time. And near the end, I'll also explain when it's important to seek medical guidance and what signs you should never ignore. Now let's talk about what safe, healthy self-pleasure actually looks like after 60, because once men understand this, everything changes. This is where confusion turns into clarity, and anxiety turns into confidence. The first thing I want you to understand is this. Self-pleasure at this stage of life is not about chasing intensity. It's about supporting circulation, sensitivity, and nervous system balance. When done mindfully, it becomes a form of maintenance for your sexual health, not just a release. One of the most important elements is cleanliness and environment. This may sound simple, but it matters more than most men realize. Wash your hands. Use a clean towel. Make sure your space feels private and unhurried. When your brain feels safe, your body responds better. This isn't psychological fluff. This is biology. Safety tells your nervous system it can relax, and relaxation allows blood flow. Next is lubrication. As men age, natural moisture and skin elasticity decrease. Dry friction can irritate the skin, reduce sensation, and create microscopic damage that takes longer to heal. A gentle, fragrance-free lubricant protects the skin, improves comfort, and allows lighter touch to feel more pleasurable. Many men tell me they wish someone had explained this years earlier. Now let's talk about presence, because this is where most men experience the biggest shift. Instead of focusing on the finish line, focus on sensation. Slow movements. Steady breathing. Notice temperature, pressure, and response. When you stay present, your brain sends stronger signals to the nerves involved in arousal. This improves control and satisfaction naturally, without forcing anything. Another key factor is body awareness. Pay attention to what your body tells you. Mild sensitivity is normal. Sharp pain, persistent discomfort, swelling, or numbness is not. If something feels off, stop. Rest. Give your body time. Aging bodies recover beautifully when given respect and patience. I want to pause here and address something many men silently worry about. Frequency. There is no single correct number. What matters is how your body feels afterward. Healthy self-pleasure should leave you feeling relaxed, calm, and comfortable, not sore, irritated, or drained. Short, mindful sessions a few times a week often support circulation and sensitivity better than rushed, intense sessions. Now let's talk briefly about the prostate, because this is an area of concern for many men watching. Gentle stimulation and regular ejaculation can support prostate circulation and reduce congestion. This does not replace medical screening, but it complements overall prostate health. If you have existing prostate conditions, urinary symptoms, or discomfort, always follow your doctor's guidance. Emotionally, this stage of life brings unique challenges. Some men grieve the way their bodies used to respond. Others feel embarrassed, needing more time or gentler touch. I want you to hear this clearly. There is no weakness in adapting. There is wisdom in it. Your body is asking for cooperation, not resistance. In my 8 years as a urologist, I've seen men regain confidence simply by changing their mindset. When self-pleasure becomes an act of care instead of pressure, everything softens. Erections become more reliable. Anxiety decreases. And intimacy, whether solo or with a partner, feels more natural again. This philosophy is at the heart of what we talk about here on PeakMale Health. Men deserve guidance that evolves with their bodies, not advice stuck in the past. Another important point is breathing. Shallow, held breath keeps the body tense. Slow, deep breathing signals relaxation and improves oxygen delivery to tissues. Many men underestimate how much breath affects arousal. Try this. Inhale slowly through your nose, exhale through your mouth, and let your shoulders drop. You'll often notice sensation improves almost immediately. And let's talk honestly about expectations. After 60, arousal may take longer. That is normal. Erections may feel different. That is normal. Pleasure may feel deeper and calmer rather than explosive. That is also normal. When men stop comparing themselves to their younger selves, satisfaction often increases. I also want to address the idea of routine. Just like exercise or sleep, consistency matters. Brief, mindful sessions maintain circulation, nerve health, and connection. This isn't about obligation. It's about listening to your body and responding with care. Now, there are times when medical guidance is important. If you experience persistent pain, noticeable curvature changes, unusual swelling, blood, or ongoing erectile difficulty, don't ignore it. These are signals, not failures. A urologist can help identify causes and guide safe treatment. Seeking help is strength, not weakness. In the final part of this video, I want to bring everything together. We'll talk about aging with dignity, confidence, and connection. I'll explain why starting fresh in your 60s or 70s is not regression, but evolution. And I'll share a message that many men tell me they wish they had heard sooner. Let me leave you with something important. Something I wish every man heard earlier in life. Starting again in your 60s or 70s is not a step backward. It's not a loss. It's an evolution. Your body is not asking you to give up pleasure or connection. It's asking you to approach it differently, with more awareness, more respect, and more care. Every stage of life has its own rhythm. In youth, the body responds quickly and intensely. In later years, the body responds more slowly, but often more deeply. When you meet your body where it is now, instead of where it used to be, something powerful happens. Tension eases, confidence returns, and pleasure becomes something nourishing rather than stressful. I've seen this transformation countless times in my practice. Men who once felt confused, frustrated, or even embarrassed about changes in their bodies begin to relax. They stop fighting time. They start cooperating with their biology, and as a result, their sexual health, emotional balance, and overall well-being improve. Gentle, intentional self-pleasure after 60 is not selfish. It's not indulgent. It's a form of self-respect. It supports blood flow, preserves sensitivity, calms the nervous system, and reinforces a healthy relationship with your own body. When you slow down, lighten your grip, and tune into both physical and emotional signals, you're doing something profoundly healthy. Remember this: your worth is not defined by speed, intensity, or performance. Your body still matters. Your pleasure still matters. Your confidence is still worth protecting. Aging does not mean disappearing. It means refining. At PeakMale Health, this is exactly why we have these conversations. Because men deserve clear, honest guidance that respects their dignity and supports long-term health. You are not alone in this journey, and you don't have to navigate these changes without understanding. If this video resonated with you, I invite you to be part of this community. Subscribe to PeakMale Health so you don't miss future conversations about men's health, confidence, and aging well. These videos are created to support you, not judge you. I'd also love to hear from you. In the comments, tell me where you're watching from and whether this topic is something you wish more people talked about openly. Your voice helps other men feel less alone, and your experience matters more than you may realize. If you know someone who could benefit from this message, share this video with them. Sometimes, one respectful conversation is all it takes to change how someone feels about their body and their future. Thank you for spending this time with me. Take care of yourself, listen to your body, and move forward with confidence. Age is not the end of vitality. With the right approach, it can be the beginning of a more grounded, connected, and fulfilling chapter of life. Stay informed, stay gentle with yourself, and I'll see you in the next video.